Bismillahirrahmanirrahim. Assalamu alaikum. First of all, thanks to International Conference on Applied Zoology 2021. My presentation topic is comparisons of different regimens in the treatment of COVID-19 in Capicam. My name is Madeeha Shah. I am from Zoology Department at Shahid Benazir Bhutto Women University, Peshawar. So my table of contents, introduction, objectives, methodology, result, conclusion, and references. So the first one is introduction. Introduction. The COVID-19 sickness 2019 broke out in December 2019 because of SARS. As of November 24, 2020, more than 59 million people have been contaminated around the world, causing more than 1 million passing. COVID-19 is postulated and incidental disorders such as fever, coughing, breathing problem, muscle ache, sore throat, etc. Some quite will be created the cutoff condition incorporated instant respiratory tubule, metabolic acidosis, and even lung disappointed. Driving expanded mortality. It's a pathogenic contamination. Biological testing from the Wuhan wholesale food market. Similarly, as other regions market transmissions. Coronavirus can be sent through direct openings to train animals to human and ecological deployment. First of the formats, the underlying instance of coronavirus are related with direct contact to contaminated creatures, and this was compartment at the ocean depth commercial center at Wuhan, China. In condition in the infection can spread starting with one individual into the next. Also the weaved of the primary type of the transmission. My objective is the principal target of the research is to find out the comparisons of different regimens in the treatment of COVID-19. Those medication were compared with other medications who was required for the COVID-19 patients, and also the patient will be recovered. And then the materials and methodology of my research presentation is data side from the Heber Teaching Hospital, Peshawar. Time duration December 2020 to February 2021. Sample size 146 patients, and data study design is data collected through questionnaire. And then gender wise distribution. So the male and female, male percentage is 49 and the female percentage is 51. So the mostly affected patient is female, whose prevalence is 51. Then age wise the mostly affected patient age is the 50 and between 50 and 60, and then 70 to 80, and the mild situation is 20 to 40-year-old people. Mostly affected people's age is 50 between 50 and 60, whose blood group is also positive, B positive. Then symptom wise distribution. So the common symptoms of the COVID-19 is fever, coughing, breathing problems, sore throat, muscle ache, tiredness, exhaustion, etc. So the mostly peoples have high fever, breathing problem, and coughing. So the percentage is 81%, and the muscle ache and the tiredness and the sore throat, whose percentage is between 40 to 50, and age is between 50 to 70. Then blood group wise distribution. So the mostly affected patients have blood group is B positive, whose percentage is about 50%, and then 40% people have AB positive, and the 20% people have O positive, and the 35% people have blood group is A positive, whose were affected and involved in COVID-19 and admitted in hospital. Then financial status wise distribution. So the financial status wise distribution, the mostly affected patients belong to the middle class family, and then the lower class family, and then the upper class family. So the mostly affected patients belong the middle class family, whose percentage is about 73%, and belong the lower class families, whose percentage is about 39%, and the upper class family belong to the whose percentage is about 3 to 4%. And then the area wise distribution. So the Peshawar is the peak point, whose percentage is 63, and then Charsadda, and then Mardan, and then Sawat. So the mostly affected area is Peshawar, whose percentage is 63%, and then Charsadda, whose percentage is about 40%, and then Mardan percentage is about 30%. And then pre-existing medical conditions. So we study about the pre-existing medical conditions. So the patients have diabetes, whose percentage is 51%, and then hypertension, whose percentage is 35%, and then asthma, and then muscles ache, arthritis, etc. So mostly affected patients have diabetes. Mild situation gender wise, so the male situation gender wise, 49% male and 51% female. So the male who were recovered in the 10 to 14 days, and the females who were recovered in 10 to 22 days, 14 to 22 days, and age wise 20 to 40-year-old who were recovered in the 8-10 days, and 40 to 60-year-old who were recovered in the 14 days, and 60 to 80-year-old who was recovered in the 14 to 22 days. And then severe condition males who were recovered in the 18 days, and females who were recovered in the 22 days, about 22 days. And the age wise, 20 to 40-year-old people who were recovered in the 15 days, 40 to 60-year-old who were recovered in the 20 days, and the 60 to 80 who were recovered in the above 20 days, about 22 days. And then the treatment remediation consists of the treatment and Haber Teaching Hospital, Peshawar. After a positive test of patient in KTH, doctor recommended Dexa injection 2 cc, Clexicane injection 60 mg, Remdesivir injection 200 mg, azithromycin tablet, propyl syrup 120 ml, and also recommended insulin injection in diabetic patient and atenolol tablets for the blood pressure patient. Dexa injection and Clexicane injection for the mild situation patients, and the Remdesivir for the severe condition patients. Azithromycin is for the throat infection, and propyl syrup for the coughing. The dose listed above are those that will be used for the standard adult treatment and has been used for the recovery. All the patient is my data collection have been recovered. For the review, we comes to the result. The Remdesivir injection, Dexa injection, and azithromycin tablet are useful for the recovery of the patients who are involved in the COVID-19 disease. So the Dexa injection 2 cc for 10 to 15 days, and a Clexicane injection 1 cc for in conclusion, our data show that the Remdesivir injection is better than the different medication in the shortening and the opportunities to recuperation in growing up who were hospitalized with COVID-19 and had proof of the lower respiratory tract infection. Meanwhile, some successful restorative choice are descriptive needed to control the COVID-19 pandemic and offer desires to save human life. We have featured the current status of the remedial device utilized in the fight against COVID-19. The current fight against COVID-19 pandemic likewise underscore. Francis Sayed, Adil Hassan, Fadin Sheikh, Somya Jamal studied about the reviews of the clinical feature, diagnostic, and the treatment of COVID-19. Pauline Chen, Kong Tech Tai survey, the treatment of COVID-19, helpful repurposing and clinical requirement, Department of Internal Medicine, Taiwan. Aziz Temuri, Elahi Mahmoodi, current option in the treatment of COVID-19, October 2020, Department of Cell and Molecular Biology, Faculty of Chemistry, University of Kashan, Iran. Hamza Jamshed, Fatima Zahid Faruddin has been studied diagnostic and treatment strategies of COVID-19, 3 August 2020. So thank you for your attention.